It's time for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with an update on Congo's Ebola. Linord?
That's right, Esther. The United Nations Secretary General Antonio Guterres is encouraging donors to honor their pledges to fight Ebola. The UN chief made the appeal Monday, one day after visiting an Ebola treatment center in the Democratic Republic of Congo, where he offered support in fighting the outbreak.
Premièrement, dans le domaine de l'Ebola,
First of all, with Ebola, we must acknowledge that the donor country pledges correspond, more or less, until the end of the year, to our needs. We must turn commitments into effective payments. So far, we have only received 15% of what we need until the end of the year. Now, a week's delay during a normal humanitarian operation is not a problem. We can adapt the program to resolve that issue. But in the case of Ebola, a week without resources, a week without a response, it doesn't mean we lose a week. It can mean we lose the war against Ebola, because things can get out of control immediately. So I have called for the donor countries to quickly make the payments they have committed to.
The current Ebola outbreak has killed more than 2,000 people and infected 1,000 others. Meanwhile, lawyers for Congo's former health minister, Oli Ilunga, say police questioned him over his management of funds to fight the Ebola epidemic. Ilunga resigned in July after overseeing the government's response to the Ebola outbreak for nearly 1 year. He denies any wrongdoing. New research warns that malaria infection is linked to a 30% higher risk of heart failure. The researchers used Danish nationwide registries to identify patients with a history of malaria infection between January 1994 and January 2017. Around 4,000 malaria cases were identified. Patients in the 11-year follow-up study were, on average, aged 34, and 58% of the subjects were male. Researchers say patients had a 30% increased likelihood of developing heart failure over the follow-up time. They note that while heart failure risk was increased for patients in the small study, there was not a link to heart attack or cardiovascular death. More research is needed to further validate the findings. The research was presented at the ESC Congress 2019, together with the World Congress of Cardiology in Paris. The World Health Organization says there is a need to rethink approaches in tackling malaria if the world is to meet the 2030 target of reducing malaria case incidence and mortality rate by 90%. The World Health Organization says accelerated research and development in new tools for malaria prevention and treatment is key if the world is to eradicate malaria in the foreseeable future. In addition, there is an urgent need for progress to advance universal health coverage and improve access to services. The findings are part of a report from W.H.O's Strategic Advisory Group on Malaria Eradication. Pedro Alonso is the WHO Global Malaria Program Director.
Malaria eradication is a hard, a highly ambitious, but a highly desirable public health goal. It will not be achieved unless we can secure three key elements. The first one is that we need to have real political leadership and commitment that translates into the financing that is required to ensure universal health coverage for all the population at risk. Without UHC, without adequate healthcare, people-centered, properly financed systems, we will not achieve eradication.
The WHO says more than 210 million people are infected by malaria every year, and about 400,000 die of the mosquito-borne disease. Over 90% of the world's malaria deaths occur in sub-Saharan Africa. Global malaria infection and death rates have remained virtually unchanged since 2015. The WHO's World Malaria Report in 2018 reveals that the world is currently off track to achieve the 2030 goals in reducing malaria case incidence and mortality rate by 90%.
The second thing we need to have in place is a more strategic, better use of data. Surveillance systems that allow us to respond in a timely and efficient way to where the problem is. And the third thing we need is new tools. With the tools we have today, the tools meaning the vector control mechanisms or tools to fight the vector, the mosquito that transmits malaria, with the type of drugs that we have today, with the type of vaccines that we have today, we can go very far.
The WHO's Strategic Advisory Group on Malaria Eradication notes there is a need to rethink approaches in tackling malaria. Last November, the international health body and the Rollback Malaria Partnership launched the High Burden to High Impact approach. This aims to jumpstart progress against malaria by targeting attention to the 11 countries with 70% of the world's malaria burden, thus 10 African countries and India. And that's our health report for today. To stay in touch, find me on Twitter at Linord Moudou. Esther?
Now, Linord, there has been some progress in preventing malaria, but we've heard of vaccines. We're not quite sure we're there yet.
Yes, so the thing with malaria, it's a bit complex because we've seen over the years some progress made with countries like Rwanda, Zanzibar, the Zanzibar island that have made some quite a lot of progress, but yet, according to figures, the progress has stalled. So what experts are saying is that more innovation is needed. We've seen that the vaccine, the RTSS, is being used in a couple of countries, so that gives hopes that malaria can be prevented in addition to what we have already, which is mosquito bed nets, treated bed nets. So yes, we're looking forward to the next few years.
Thanks, Linord. Be sure to watch Linord Moudou's health reports every Tuesday on Africa 54.